Epilepsy is incredibly common. It's seen in 1 out of 26 people throughout the world. There are now 5 different ketogenic diets we use for epilepsy. There's the classic ketogenic diet, which is usually a 4-to-1 ratio of fats to carbs and protein combined. There's something called the MCT diet. 90% of the calories are made up of fat. Then we have like 3 what we call alternative diets. The modified Atkins diet, the low glycemic index treatment, and then there's the modified ketogenic diet England or UK version. It's not always clear that ketones are why the diet works. In fact, you have patients who have no ketosis, yet being on this therapy seems to be very helpful for them. And if they stop it, the seizure will come back. There's different theories. Maybe it has to do with the kind of fats that the child eats or the adult eats, that some fats are better than others, maybe helping improve the way the brain works. There's different theories about glucose, that the ups and downs of your blood sugars, if you have epilepsy, is not a good thing for that. And thus, being on a ketogenic diet may stabilize your blood sugar, and that may be helpful for why the diet works. Unlike drugs, where if they have a side effect, that's it, right? You've got to stop the drug if they have a rash or an allergy or, a serious side effect on it. With the diet, most of the time we can modify the diet or add supplements to improve the patient's health and keep them on the diet if it's working. The diet works quickly. So the diet generally does seem to work within 1 or 2 weeks.
Could we just, for the benefit of those who aren't, could we just define exactly what epilepsy is? Is the condition acquired? Is it inherited? And how widespread is this condition across the world?
Epilepsy is incredibly common. It's seen in 1 out of 26 people throughout the world, all genders, all ages, a little more common in younger children and then in the elderly. Epilepsy is basically having at least 2 seizures or 1 seizure with an abnormal EEG that suggests you're more likely to have seizures. It can happen for many, many, many reasons. So epilepsy can be genetic. There are many genetic epilepsies that we're finding nowadays. It can be due to trauma. It can be due to a metabolic disorder that epilepsy and seizures are part of. It can be due to a structural abnormality. It's pretty common in kids where their brain just didn't form correctly, and that can predispose them to seizures. And there's lots of other causes for epilepsy, but most of the time we see children will do an EEG, an MRI, some blood tests to try to find out the reason why. But yeah, it's not an uncommon disorder.
You work particularly with children. I'm just curious as to whether it's possible to be diagnosed with epilepsy after a seizure, for example, in someone who's an adult, never having had any seizures as a child.
Yeah, so it definitely can happen in adults. Adults are, another population that, there's probably more adult epileptologists than pediatric nowadays, and it can happen. Sometimes there's no cause found despite a huge workup. We call it idiopathic epilepsy. But similarly to children, we also do a large workup in adults, sometimes even more of a workup to try to find the cause.
Well, let's talk about some of that work, because we have to go back about 102 years to Dr. Wilder, who produced the first studies that were published in the Mayo Clinic Bulletin all of 102 years ago, where he used a particular dietary approach, a therapeutic ketogenic approach to treat children who presented with epilepsy. Could you talk to me about this?
I think even before that, it's good to take a step back and sort of highlight the sort of the wide array of therapies we have for epilepsy, kind of where the ketogenic diet, or now we call them ketogenic diet therapies, fit in. I think it's important to realize all of the options available. So most patients, usually we start them on medications. There are about 25 anti-seizure medications available, new ones coming out all the time with different mechanisms of action. For the most part, these therapies work. And most of them, even in children, have very few side effects. So the vast majority of patients we take care of, we put them on medicine and they do great. But there are patients who medicines just, for various reasons, don't work for. And when we start trying medicines and 2 or 3 fail, usually we look for plan B. We say, what other choice do we have? Then we think about ketogenic diet therapies, which we'll talk about. We think about something called neurostimulation. where we use electrical devices, either directly to the brain or indirectly to the vagus nerve, to try to stop seizures. And then we also think about epilepsy surgery. So if we know where the epilepsy is coming from, be it a structural problem or even if there's no structural cause found, if we can identify the one source, we will sometimes do epilepsy surgery, which can be curative. We can actually stop the epilepsy by removing that part of the brain, which is really an important topic that we do mention to families even at the first visit. If the medicines don't work, there may be a surgical option. The ketogenic diet, as you mentioned, has a long history going back 100 years when we really weren't doing a lot of epilepsy surgery. There were no neurostimulation devices and really only about 2 or 3 medicines on the market. And so when it came out in 1921, it was one of the few therapies, and it was very, very popular at the time. They didn't know why it worked. They really actually didn't know a lot about epilepsy and why epilepsy happened. But they knew, based on historical documentation and some studies, that fasting, periods of fasting, would help seizures even beyond the point when the food would be reintroduced to the patient. They didn't quite understand that, but they knew that this brief period of fasting, sometimes even it was a week or two, would help. Interestingly, the ketogenic diet, was created with that in mind. So they thought that the ketogenic diet would mimic starvation, would mimic fasting. And even still today, you see that in chapters and reviews, that the diet was created to mimic fasting. We know now that it's probably completely different, that they were right. Ketogenic diet worked, a high-fat, low-carb diet worked, but it's probably completely different than fasting. That works too, but for different mechanistic reasons, interestingly. But that was back 100 years ago, and we've had lots of changes, but the diet is still being used. It's now being used in adults. It's being used sooner rather than later. We're using it in babies, which we never used to use it before. So it's kind of had a renaissance, which is a fun topic in and of itself, how it sort of came to become popular again. But it is in the epilepsy field absolutely mainstream. All epilepsy centers offer it for the most part, not always in adults, but definitely in children. And families can find out about it in almost anywhere.
That resurgence in the ketogenic diet's use in treating epilepsy, has that come about as a result of the complexity of epilepsy as a condition, and that there are so many different kinds of epilepsy? So you mentioned drugs already. They had come to the fore, I think, probably in the 60s, 70s, 80s. And the ketogenic diet and use of it had taken a backseat, but it's come around again almost full circle. Is it as a result of the complexity of epilepsy that the drugs aren't always the answer?
Yeah, it's probably multifactorial. Certainly, even in the 60s and 70s, as we were starting to get some new drugs, there was a recognition that not every patient is going to respond to it. And so, I would say even back then, there was a recognition that we need other options, be it epilepsy surgery, VNS, neurostimulation, and the diet. Almost all of those 3 major categories really took off in the 1970s and 80s, I think, as a result of a recognition that we need other choices. I don't know that it's necessarily due to the complexity of epilepsy. Epilepsy really hasn't changed much over the last hundreds of years. There's still the same causes we're finding. We're just, I think, identifying the genetic causes more than we used to do. Back 20, 30 years ago, we would say we don't know why they have epilepsy. Now we can find the genetic cause. That has changed, and the imaging has gotten better. MRIs are getting better at finding small little malformations that we never would see before.
So what is the ketogenic diet doing for the brain of the person who has epilepsy? What is the mechanism of action?
Oh, and that's a fun topic in and of itself that, we're learning, by the year, not even by the decade, but, changes are happening so fast in that aspect of my field. It's hard to keep up. Again, the thought back 100 years ago was that the diet worked by mimicking fasting and starvation. That was sort of, realized that probably wasn't true about 10, 15 years later. We now believe that it's sort of, again, many different variables that are at play. We know that diet creates a state of ketosis, which is sort of well known, and you can measure those ketones. It's not always clear that ketones are why the diet works. In fact, we have patients who have no ketosis, yet being on this therapy seems to be very helpful for them. And if they stop it, the seizures will come back. There's different theories. Maybe it has to do with the kind of fats that the child eats or the adult eats, that some fats are better than others, maybe helping, improve the way the brain works. There's different theories about glucose, that the ups and downs of your blood sugars, if you have epilepsy, is not a good thing for that. And thus, being on a ketogenic diet may stabilize your blood sugar, and that may be helpful for why the diet works. There's different theories about amino acids, adenosine. The mitochondria of the neuron seems to work better, if you're on a ketogenic diet. And then very recently, there's been a lot of work in the gut microbiome, sort of bursting onto the scene over the last 5 to 10 years, that through some elegant experiments, that there's something about different gut microbiome bacteria that seem to sort of create and sort of cause GABA levels to go up. And so some of the bacteria may be working as an anti-epileptic effect on children and adults who go on it. If you sort of wipe out those bacteria in some experiments in mice, the ketogenic diet, the therapy they're on doesn't seem to work. And if you give them sometimes a colonic transplant back for a mouse that was on the ketogenic diet before, it seems to work again. So there's maybe something in the gut microbiome that seems to be effective. And I think suffice to say, that it's not that we don't know, it's just like which of these mechanisms may be more important for some epilepsies. We still have to figure out. A lot of drug companies are very interested in the ketogenic diet because their drugs work through channels, not really metabolism. And so the companies are very interested to say, hey, this may be leading to a whole new class of anti-seizure medications if we look at why the diet works versus how many different drugs work. And so we're working with a lot of different pharmaceutical companies to kind of tease out which mechanism may be helpful. So it's multifactorial. I think it's important to realize for all your listeners that are, listening to this, it's not that epilepsy is a metabolic problem. It's different. It's not diabetes. It's not obesity. The diet as we use it for epilepsy is treating the underlying, hopefully, the epilepsy that is going on. It's not fixing a problem necessarily that is going to go away by being on a diet. It's a treatment. It's not necessarily getting to the root of the problem, if that makes sense.
Let's look at that distinction as far as the ketogenic diet for this condition is concerned. People will be familiar with the ketogenic diet for metabolic dysfunction and weight loss, etc. But how is this different as far as ratios and macros are concerned?
Yeah, and that's a great question. First, again, it's very different, I think, than the way we view, low carb diets for diabetes or obesity, where, it's sort of getting to the root of the metabolic problem. For most epilepsies, again, it's not a metabolic problem. So, the mechanisms that we believe by which ketogenic diet works are very different. It's not, boosting your adenosine is not fixing the problem or changing your gut microbiome. And so, that definitely is very different. We use these diets, again, in a way to try to help the seizures. Usually when we put children on the diet, it's usually only for a couple of years. And then we take them off the diet and they seem to do very well. Maybe, again, you've sort of quieted down their epilepsy. That's, I think, a hot topic now, is the diet altering the course of their epilepsy, not just treating the seizures and making it less likely to happen. I think that answered you. Was there another part of your question?
Well, I just wanted to know, just in terms of the ratios of the macronutrients.
Yeah, right. So, and that's, again, up for discussion. There are now 5 different ketogenic diets we use for epilepsy. There's the classic ketogenic diet, which is usually a 4-to-1 ratio of fats to carbs and protein combined, where foods are weighed and measured. There is something called the MCT diet, created in the 1970s, which is more in terms of percentages of MCT fat of all the fats that are taken in. And so children who are on an MCT diet might be on a 50% or a 40% MCT diet. Still a very high ratio. Still, again, about 90% of the calories are made up of fat. Then we have like 3 what we call alternative diets: the modified Atkins diet, the low glycemic index treatment, and then there's a modified ketogenic diet England or UK version. sort of rounding out all 5 diets. Those 3 other diets are usually done as an outpatient, so children and adults are not brought into the hospital. They tend to be more like a 1-to-1 or a 2-to-1 ratio, but it can vary meal by meal. Foods are not measured and weighed. They're more sort of, looking at ingredients and trying to keep the carbohydrates low and trying to encourage fat. So it's a little more of a independent, created by the families, not like mandated by a dietitian. But all 5 diets are generally, again, high fat, low carbohydrate, moderate protein diets. They're just a little different in how they're initiated and maintained.
Are you, as a consequence of the fat intake, having to monitor on an ongoing basis the patient's lipid profile?
Absolutely. Yeah. And so, one of the most important things we tell families, number one, is, with any of these 5 different ketogenic diet therapies, they should do it with a neurologist and hopefully a dietitian together, helping to sort of manage and make sure they're safe on it. These diets do have risk. These diets are not designed to be healthy, although we can certainly make them healthier by sort of looking at the different fats and giving supplements to try to help avoid the side effects. One of the nice things about diet therapy is, for the most part, side effects don't lead to discontinuation. Usually we stop the diet because it's just not helping their epilepsy, and it helps about half of the patients we started on. Certainly doesn't help all of them. But unlike drugs, where if they have a side effect, that's it, right? You've got to stop the drug if they have a rash or an allergy or, a serious side effect from it. With the diet, most of the time we can modify the diet or add supplements to improve the patient's health and keep them on the diet if it's working. Most of the side effects tend to be gastrointestinal. So most of the patients who are on the diet, if we have an issue, it's constipation or hunger or weight loss or sometimes reflux or vomiting. Usually, for the most part, we can address that successfully. There are some more sporadic side effects, as you mentioned. We do have to keep an eye on their lipid profile. There's a lot of studies in adults who are on ketogenic diets for epilepsy to look at carotid distensibility and heart function and more subparticles of the cholesterol factors like lipoprotein. So that's really at work. We do occasionally see children who have kidney stones. Sometimes we have children who have decreased height velocity. Children are growing and we want to make sure they keep growing, so we have to look at that. There is some research looking into bone density, very interesting research, that the longer you're on, at least the classic ketogenic diet for sure, you could have some bone density changes. So people are looking into that and ways to fix those issues. And we do see occasional vitamin and mineral deficiencies if the child or adult is not getting enough of the multivitamins and minerals. Rare, okay, thankfully rare, but can happen if they're not being supplemented. So we look at these very carefully. Our dietitians, our neurologists who are using the diets really try our best to make sure that these children don't have these kind of adverse effects.
Just on the subject of supplementation and bringing up that subject of lipid profile again, carnitine, I believe, is a supplement that's used in order to help normalize that lipid profile. Could you talk to me briefly about this?
Yeah, carnitine's an interesting topic that I would say back about 10, 15 years ago was more of interest. It's actually fallen off a little bit in our community, not as much research as there was years ago. But back years ago, there was a lot of discussion and actual controversy about how important it was to be on carnitine while you're on a ketogenic diet. Generally, most children, the longer they're on a ketogenic diet, at least a classic ketogenic diet, will become secondarily carnitine deficient, especially if they're on a drug called valproate. And so we do monitor carnitine over time. Again, back 20 years ago, some centers would put everybody on carnitine. Some centers would put nobody on carnitine. And then everything sort of in between. And things really haven't changed a lot over the years. We do certainly see carnitine deficiency, secondary carnitine deficiency manifest as children becoming tired, becoming flushed, not necessarily getting the same ketone levels they were before. We will sometimes check carnitine levels and supplement if they're low. We do sometimes, as you mentioned, use it to try to improve the lipid profile. There's not a lot of data behind that, actually, but anecdotally, some centers, including ours, will try that if the lipid profile becomes more abnormal than we'd like to see. Whether that helps or not is kind of a subject of a further study.
How quickly will you see an improvement or a reduction in the number of seizures in a child if you're going to see any reduction as a result of dietary changes?
Yeah, it's what's interesting about the diet, certainly compared to neurostimulation and probably compared to medicines. Well, at least some medications, I'll throw that in as a caveat. The diet works quick. So the diet generally does seem to work within 1 or 2 weeks. In most studies, if the diet is being used for seizures that are so frequent, you can track that. So you can imagine some children have seizures once a month. You may not know until a few months in whether the diet's working, but many of our patients have seizures every day. And if you track on a calendar, a lot of times within 2 to 4 weeks, you're going to see the seizures decrease. They might continue to decrease over the next few months, and they may become seizure-free at 3 months or 6 months. But in most of our patients, you're going to see a response, if it's going to happen, usually within about 2 to 4 weeks. So as we're discussing this as an option with families, as you can imagine, they're nervous, they're concerned their child isn't going to be able to do it. One of the nice things about ketogenic diet therapy is we can tell the families that, generally, we'll know pretty quick. So, we're not going to say keep your child on this for months or years if it's not working. We'll try it, and then if it's not helping after like a month or two, we could maybe stop it. And that actually is an incentive to families to give it a shot.
Is epilepsy a condition for life?
Not always. So it depends on the cause, right? A lot of children can outgrow their epilepsy. Even some of the tougher epilepsy syndromes sometimes can get better and improve over time. Structural abnormalities, as you would imagine, a little less likely that that's just going to go away. Metabolic conditions, of course, probably also wouldn't go away. But some of the conditions, sometimes if we don't find a cause, the epilepsy may be time limited and can go away over time. Adults, the studies would say a little less likely for that to happen. But at least in pediatrics, we will sometimes, again, stop the diet or even medications after 2 or 3 years if the seizures seem to have kind of remitted. And so that's generally our recommendation to families is like give the diet, 3 months to see if it works. But if it is working after 2 years, not every child, but in many children, we can try to come off the diet and see if they no longer need it. And sometimes, again, 80% of the time, you can come off the diet successfully and not have to go back on the diet. Adults, it's a little less likely. And so in the adult centers that are using diet therapies, especially if an adult is driving, life is good, they're doing well, they're a little less likely to try to come off the diet, or at least recommend it. But in children, we will sometimes try.
Interestingly, I spoke with Dr. Mary Newport a few months ago, whose husband was suffering from Alzheimer's disease. And you mentioned MCT oil and the production of ketones earlier. She found that placing him on this particular ketogenic diet that resulted in the production of ketones and ingesting MCT oil, he saw an improvement in his Alzheimer's. I'm just wondering if you know of any other anecdotal evidence of improvements in neurological or neurodegenerative disorders as a result of ascribing to a ketogenic approach.
Great questions. So it's sort of twofold answer to that. I mean, in the epilepsy field, that has been something people are really interested in. There's actually a large study starting out of England called the CORE, C-O-R-E study, where they're looking at quality of life, cognition, seizure severity, other things besides just the seizure number, to see if maybe the diet has some improvement in that. There has always been, for the last 100 years, anecdotal descriptions of children who, even if the seizures are not dramatically better, they seem brighter. They seem more, with it. They are less impaired. Their learning can improve dramatically. The tough part for those anecdotes is other things are changing, right? So if your EEG is getting better, we know that all of those things can get better too. If you're not having seizures every hour, of course, your cognition, your learning is going to get better. A lot of times we will reduce the anti-seizure medications that children are on. And that's also important to mention. Again, children and adults who are on ketogenic diet therapies, 85% are still on medicines. It's not an or, it's more of an and. But if they're doing well, we may try to reduce those medicines. That makes sense, right? They might be better and brighter if you can get rid of some of those seizure medicines. And so very tough to sort of tease that out. How much of this is the diet versus some of the other factors involved? There have been a few studies that have shown improvement on behavior, not necessarily cognition, but sort of abnormal behavior in these children. Some studies out of Europe where they try to account for all of the other variables. And independently of that, it seems like behavior improves, but very few studies that have really demonstrated that. So that's the first part of my answer to that question. The second part is, again, even in the pediatric world, people are looking at ketogenic diets for autism to see if that would be beneficial. As you mentioned, Mary Newport and other people are looking at it in adults with Alzheimer's and dementia to see if also that could be helpful. The studies are mixed so far. So some studies have shown benefit, some studies have not shown benefit. The mechanism of action for any of these non-epilepsy conditions may be very different than epilepsy. And that's obviously important to know because, for example, maybe for autism, it has nothing to do with ketones, but for epilepsy, it does. Maybe for dementia, it has to do with the gut microbiome. And maybe that's not true for epilepsy. I mean, these are, things we'll learn over the next 100 years, I think. But it is an important topic. Parents, of course, and patients would like for their child to be better and brighter and do better in school. We tell the families we hope that'll happen. We've seen it happen, but we really are targeting the epilepsy, so we can't guarantee it.
And in that case, then, are you hopeful for the future, given that there is an increasing body of research being done in this particular area?
Oh, for sure. There's a lot of interesting research being done. Again, as we've had alternative diets, more supplements, safer ways to do the diet, I think other fields are becoming more interested in ketogenic diet therapy, saying, hey, maybe we can do a study or a protocol that is safe, is well tolerated, and maybe will show benefit. And so I'm often approached, a lot of other epilepsy ketogenic diet experts to give advice to some of these other fields that are looking at designing clinical trials. One of the fastest growing today is the use of it for psychiatric conditions. I don't know if you've had anybody else on your podcast from that field, but it's burgeoning. It's very interesting. There's a group called Metabolic Mind they have their own podcast where they're looking at diet therapies for bipolar, schizophrenia, depression, other conditions to see if that may be helpful. And they're looking at ways to design these trials to, again, be easier and safer for patients to do it. Stay tuned. I think we're likely to hear more, over the next decades about how beneficial these can be.
Well, I know if you want to find out more, you can check out Dr. Kossoff's book, Ketogenic Diet Therapies. I'll pop a link to that book in the show notes of this episode. If people want to find out more about you, where can they go?
Absolutely. So there's a lot of great information on the internet for patients, but also for researchers. For patients, we always recommend the Charlie Foundation's website. They're the U.S.-based main charity that helps with ketogenic diet services. And then in England and actually throughout Europe and even South Africa, there's Matthew's Friends, excellent resources, good information about, again, predominantly using diets for epilepsy. There's a lot of also good information about the ketogenic diets for scientists. And so I usually recommend the Epilepsy Foundation's website. We have a website through Johns Hopkins that has lots of good links and materials. But maybe the best nowadays is our new society. It's called INCS. So the International Neurological Ketogenic Society was formed about 4 years ago. And the website is neuroketo.org. That has a lot of links to the science behind how we're doing the diets and links to researchers. And this is a growing society that I'm part of, and a lot of other people in the neurologic ketogenic field are part of it too. Really try to advance the science for the ketogenic diet over the next decade.
Lots of great resources, which I will link in the show notes for this episode. Dr. Eric Kossoff, thank you so much for your time today.
My absolute pleasure. Thank you for having me.
Hey, if you like that video, check out this video here, which tells you how to get rid of that stubborn belly fat.